Hello, I am Dr. Aizaz from MedicoVisual.com back with another visual lecture, and we are basically starting a series of lectures on the topic of insulin resistance. I am sorry for being inactive on this channel for quite a time, but I promise that I will try to be active on this channel from now onwards as much as possible. So the CVS embryology course, it is under development, and it will be available by next month. But before that, we are starting a relatively short series of lectures on insulin resistance. So this is the first part of that lecture series. So in today's visual lecture, we will talk about what is insulin resistance. Welcome to this visual lecture. So, what is insulin resistance? When a particular insulin concentration produces less than expected biological response, this is called insulin resistance. Okay, I will explain you what I mean by this, but you just remember that the problem here is that a particular concentration of insulin, it should produce a biological response, but it is producing suboptimal response. It is not producing as much response as we expect from that concentration of insulin. So that means that there is some resistance to actions of insulin. Someone is resisting the insulin, someone is resisting insulin from performing its proper actions. So, what are the actions of insulin? There are plethora of biological actions that are performed by insulin. We will not talk about all these actions, especially in this visual lecture series. The clinically most important action that insulin produces is that it lowers the blood glucose level. But if there is resistance to that action, so if insulin is not efficiently able to perform this function, if insulin is not efficiently able to decrease the blood glucose level to the normal range, it means that hyperglycemia will occur. So insulin is there, but it is not being able to perform its function efficiently. So of course, in that case, persistent hyperglycemia will be there, and diabetes might develop. So this is insulin resistance. Let's suppose that a person is having 200 mg per dl blood glucose level. Now, to lower this blood glucose level to, let's say, 150 mg per dl, 1 unit of endogenous insulin might be needed. So body might create, let's say, 1 unit of insulin, and that 1 unit of insulin, it might bring the, in a normal person I'm talking about, that this 1 unit of insulin, it might bring the blood glucose level from 200 mg per dl to 150 mg per dl. This is normal action, normal efficiency of action of insulin. But if there is insulin resistance, what will happen? That, let's suppose, if we give, or if a body creates endogenous 1 unit of insulin, rather than decreasing from 200 to 150, it will, perhaps it might decrease only up to, let's say, 170 mg per dl. So rather than a 50 mg per dl decrease in blood glucose level, the same concentration of insulin, it is decreasing the blood glucose level by 25 mg per dl only. So 1 unit is this insulin concentration, and we were expecting this insulin concentration to decrease the blood glucose level by 50 mg per dl, but it has not met our expectations because there is resistance to performance of actions of insulin. So that is why it is working less efficiently. So now, body might need another 1 unit of insulin to decrease the blood glucose level from 200 to 150. So in other words, we will, rather than 1 unit of insulin that were needed to decrease this To reach this blood glucose range, we now might need 2 units or even more units of insulin in a person with insulin resistance. So this is the basic concept that what is insulin resistance. So after having understood that what is insulin resistance, now the question arises that why we should study insulin resistance. What is the significance of studying insulin resistance? This is because it is this insulin resistance, it is culprit behind the development, behind the pathogenesis of type 2 diabetes mellitus. We know that in type 1 diabetes mellitus, the beta cells of pancreas, by the way, you must be knowing, if you are here watching this video, you must be knowing that the insulin, it is created by beta cells of pancreas. So it's very simple in case of type 1 diabetes mellitus that there is basically destruction, autoimmune mediated destruction of beta cells of pancreas. So as the beta cells are dying, and when more than 90% of beta cells they die, then there will be severe deficiency, there might be absolute deficiency of insulin. So naturally, when insulin is not there, insulin is not present, insulin is trying to bring the glucose level from higher range to normal level. Basically it is lowering the blood glucose level. Obviously when insulin won't be there, there will be hyperglycemia, and that would lead to diabetes mellitus. That is very simple in case of type 1 diabetes mellitus. Of course we will not discuss the pathogenesis of type 1 diabetes mellitus in this lecture, but the basic idea is that there is immune mediated destruction of beta cells of pancreas. But in case of type 2 diabetes mellitus, the story is not that simple, my friends. It is very counterintuitive. You know, beta cells are there, and especially initially they are present and healthy, relatively healthy. Of course later on beta cell failure will occur in most of the people, but at initial stages beta cells are there, they are producing insulin, and insulin is normal. But still, this insulin is not able to perform their functions. Even the insulin level might be higher than normal. So that is quite counterintuitive, that insulin is there, its level is either normal or even more than normal, especially initially. But still there is hyperglycemia. So that is why, to understand that type 2 diabetes mellitus and its pathogenesis, you must understand what is insulin resistance. And remember, without having a clear concept of pathophysiology, pathogenesis of any disease, you cannot properly manage a disease. You cannot be a great physician if you do not understand the basic concept of any type of disease. But you know, insulin resistance is not only the culprit behind type 2 diabetes mellitus. Even in type 1 diabetes mellitus, especially in obese people, insulin resistance might be there. So because of this reason, in an obese patient of type 1 diabetes mellitus, more than expected exogenous insulin might be needed. Of course, you must be knowing that because there is absolute deficiency of insulin in type 1 diabetes mellitus, this person is dependent upon insulin. So this patient of type 1 diabetes mellitus, he or she must use insulin, subcutaneous insulin, to survive. So in that insulin dependent patient, if in type 1 diabetes mellitus, on top of type 1 diabetes, there is insulin resistance, then what will happen, that more than normal units, more than expected units of insulin might be needed to compensate for hyperglycemia and other metabolic problems associated with diabetes mellitus. But that is not the end of story. Many non-type 1 and non-type 2 diabetes mellitus, I mean secondary diabetes mellitus, in those many different types of secondary diabetes mellitus, again the insulin resistance is culprit. For example, let's say someone is having Cushing syndrome and cortisol hormone is high in his or her blood. So in that patient, insulin resistance might develop. I'm not gonna talk about how it develops in this lecture. We will have a detailed discussion later. But the point which I want to highlight here is that in many different types of diabetes, insulin resistance is the culprit. Even in a normal healthy person, in a normal healthy person who is obese, insulin resistance is almost invariably present, and it's the cause of many different problems. So it's very important to understand that how insulin resistance occurs. I can bet that you must have read and heard this term insulin resistance multitude of time in your life. You know, in textbook they simply say that in type 2 diabetes mellitus there is insulin resistance, and most of your textbook they don't even bother to explain what the heck is this insulin resistance. So that is why I am here to help. Dr. Aizaz is here to help you understand the insulin resistance. But the question remains how insulin resistance occurs. What is the mechanism of development of insulin resistance? But before I start the discussion about insulin resistance, a bit of disclaimer here that not much is known about the precise mechanisms of insulin resistance yet. So the information that is being presented in this video might not be complete picture of the molecular details, and it might not be 100% accurate because research is going on for years, for decades, and data is continuously evolving regarding the mechanisms. So let's start that how insulin resistance occur. So here is a cell. It could be any cell, and preferably let's say it's a muscle cell. Okay, so there is that lipid bilayer, and here is insulin. Now insulin, what it wants to do is that it wants to increase the uptake of glucose by this cell, and then it wants to increase the utilization of that glucose by this cell, and it also wants to increase the storage form of glucose in this cell. So basically by doing so if let's say here is glucose, so if this cell increases the uptake of glucose, and then uptake of the glucose is increased and utilization of glucose is increased, and even the storage of glucose as glycogen is increased, then what will happen that as glucose is shifting intracellularly, so here is the blood vessels are there, so as more and more insulin is not insulin sorry as more and more glucose is shifting intracellularly, the level of glucose in the blood will decrease. So this is the basic mechanism by which the insulin is trying to decrease the blood glucose level. But there is a problem. Here is insulin, and it is a peptide hormone. It is a peptide hormone, it's a polar molecule. It cannot cross this lipid bilayer without any carriers. So it does not have particular carriers with which it can easily enter inside the cell and perform its function. So what it will do? It will ring the bell, right? And after ringing the bell, what I mean by ringing the bell is that it will bind with its receptor, and after binding with this receptor will become active, and it will start a cascade of events. There will be a series of events that will be started, and the end result will be that there will be a decrease in blood glucose level. At this stage, I am not gonna talk about that what is this IRS and what happened here. There is, by the way, phosphate that is bound to the receptor and then to the IRS. what I want to highlight here at this point is that first there is binding of insulin with its receptor to the extracellular part of that receptor, and then a series of events start intracellularly that leads to lowering of blood glucose level. Now, here you just try to understand this concept that if this doorbell is faulty, I mean, if there is some problem with this receptor, let's suppose this receptor it is not able to properly bind with insulin, or even if it binds with insulin, it cannot initiate the signaling cascade, it cannot initiate the intracellular series of events that would have led to decrease in blood glucose level, then of course it means that there will be resistance to action of insulin. Similarly, the post-receptor components, the components that comes after the receptor in that series of events, if those those components, if those components are faulty, or something is done with those those components in such a way that those components they become less efficient, that might lead to insulin resistance. So what they say is that there is some problem with the receptor or post-receptor components of signaling cascade that leads to insulin resistance. So problem can be from anywhere from the receptor up to the glucose transporters called GLUT4. We will discuss maybe later that insulin, what it does is that it increases the translocation of special glucose transporters on the cell membrane, and as more glucose transporters are translocated on cell membrane, then what will happen that more glucose will enter inside the cell. So problem can be anywhere. Problem may be here, it might be here, it might be here, or even up to GLUT4. Even the enzymes, the metabolic machinery, they might be defective. Now usually what happens if I talk about type 2 diabetes mellitus, usually what happens is that it is not purely a genetic disease. Of course, at genetic level, there is some genetic variability or polymorphism in such a way that these receptors or post-receptor components, they may not be as efficient as in general population, but that solely cannot usually lead to diabetes mellitus. I'm saying usually because there are some rare cases of development of diabetes solely due to genetic reasons, but usually only the hereditary problems, they do not usually lead to diabetes mellitus. Of course, most of the people, many people with diabetes mellitus, they have that genetic component, they have that genetic component, they have that genetic problem, but later insults in life, they actually contribute to development of diabetes mellitus, and that includes your eating habits and your physical activity. For example, if someone is taking lots of nutritions, much more than his body needs, then that might trigger in some way, that might trigger, we will discuss later that how it triggers, how increased fatty acids, how that trigger the problems related with these receptors and post receptor components. So that might be a reason. Then along with that, if someone is leading a sedentary lifestyle, there is very less physical activity in his life, that may contribute to development of insulin resistance, which might ultimately lead to diabetes mellitus. Here again, another important point that must be stressed here is that insulin resistance alone usually does not cause diabetes mellitus. It is one of the component of pathogenesis of type 2 diabetes mellitus, but later on there is the dysfunction of beta cells as well. So we will discuss those details later. And the take home message from this discussion is that In insulin resistance, it is usually caused by a receptor or a problem with the receptor or post receptor signaling cascade. What I think of this whole scenario, whole this story is that insulin resistance is like an angry wife or angry girlfriend. You are happy, you are there. I mean, insulin is there, and you are trying to stimulate her, you are trying to bind with her, you are trying to stimulate her, but she failed to get stimulated because she is angry. So here you are insulin, and here is the insulin signaling system, receptor or post receptor components. So these receptor or post receptor components, they are angry and they fail to get stimulated. But how these problems occur, we will discuss these things one by one. So as I have told you previously that diabetes mellitus is a multifactorial disease. It is not solely caused by the hereditary factors. It is not solely caused by genetics. One of the classical example of hereditary type of diabetes, and it is not just diabetes, it leads to plethora of problems, multitude of problems, and that is there is genetic defect in severe genetic mutation of these insulin receptor, and this defect is so severe that only this receptor, it is only 14% or 15% as efficient as normal receptor. So if that much severe mutation in insulin receptor is there, and that is due to some genetic reason, it is called as Leprechaunism or Donohue syndrome. I'm sorry, I'm not so good at pronunciation. So what I want to stress here is that if there is a severe mutation in this receptor, from this point onward, this signaling cascade, it will not produce, it will not proceed, and that will lead to not just hyperglycemia but many different metabolic and non-metabolic problems. You know that insulin is not just a metabolic hormone, it's an anabolic hormone, plus it's a growth factor as well. Cells need insulin for growth and cellular differentiation, cellular growth. For cellular growth, insulin is very important hormone, especially in the prenatal life and after postnatal life as well. It is important, but the point to highlight here is that it is a growth factor as well. So if there is a severe insulin resistance due to receptor defect, or that what we call as leprechaunism, what it will do is that there will be severe growth delays and lots of metabolic problems. Unfortunately, such children, they rarely survive beyond 1 year of age. But the good thing is that this disease, this leprechaunism, it's very rare disease, fortunately. So now we will discuss that how the insulin resistance occurs postnatally. Insulin resistance is almost always associated with obesity. As I have told you previously that an obese person, there is almost more than 90% chance that even a healthy looking obese person, he or she might be suffering from insulin resistance almost invariably. That doesn't mean that he or she will have diabetes, but most likely he or she will be having insulin resistance. And because of this reason, most of the patients of type 2 diabetes mellitus are obese. By the way, how can you remember that the type 1 diabetes mellitus patient, they are thin lean, and type 2 diabetes mellitus patient, they are obese? Well, it's very easy to learn. So let's write 1 here, the Roman 1, and let's write 2 here. This is for type 1 and this is for type 2. Then draw a circle around this one like this, and also draw a circle around this, and then complete the figure. And now you might realize that which of these is obese. Of course, the person with type 2 diabetes mellitus. So, in this way, you can remember that obesity is linked with type 2 diabetes mellitus. Now, it's important to understand that how obesity leads to development of type 2 diabetes mellitus. We will discuss those details in the next lecture, but here I will just give you a brief idea that in obesity certain factors are produced. First, there is increased free fatty acid, and along with free fatty acid certain other factors are produced, and those factors they do something with this insulin receptor substrate, this IRS, that it fails to work. This is one of the most important reason, but there are numerous other reasons of development of insulin resistance in obese people, and we will discuss all those details in upcoming videos. So I hope you got some concept clarity of insulin resistance. Thank you so much for watching this video. I will see you in next video. Have a nice day.